Hear with your eyes, see with your heart, compassionate healthcare. This presentation encourages the use of hands-on techniques and the use of your sensory skills to help provide compassionate care while teaching the differences between sympathetic, empathetic, and compassionate care. It was developed by yours truly, Connie L. Montgomery, retired occupational therapist and volunteer patient and family advisor, and Connor J. Jocelyn Graham, graduate studies student at MUSC Health in Charleston, South Carolina. Please feel free to contact us at montgomerygraham2009 at gmail.com. No portion of this presentation may be copied or used without express written consent given by us. Thank you. Now, please consider the whole being when providing health care. Most of us have a lot more going on in our lives than we are willing to openly share. We are complex human beings, mentally, physically, emotionally, financially, spiritually, and culturally. Every person is trying to balance the issues of life. Now, imagine adding a health crisis or chronic illness to the scope of things one has to manage. The task can seem daunting, if not totally overwhelming. Therefore, if you are a care team member who gets an opportunity to serve a patient and or family, consider using all your sensory skills and medical expertise. Focus on the whole person by looking, listening, learning, and connecting with your patient and family. Hear with your eyes. What does this mean? It means to use visual cues to hear what is not spoken. People speak with their body language. People speak with the expressions on their faces. So be in tune. Use all 5 of your sensory skills here and your medical expertise. It will help build foundational information to provide the most thorough treatment for your patients and families. See with your heart. I'd like to say, see people through the eyes of love. Listen to the information they are sharing. Hear what they have to say. And utilize this information to help with your evaluation and treatment process using your heart as a vision tool. The research article we used in this presentation is entitled Sympathy, Empathy, and Compassion, a grounded theory study of palliative care patients' understandings, experiences, and preferences. There was 53 terminally ill cancer patients in an urban hospital setting that was utilized for this experiment. And the authors, Shane Sinclair, Kate Beamer, Thomas Hack, Susan McMcClinty, Shelley Raffin-Bochel, Harvey M. Chokchutinov, and Neil Hagen. They had these individuals used in this study to use their understandings, their experiences, and their preferences to help us better understand sympathy, empathy, and compassion. And what they found was sympathy is the care model not recommended. It is a pity, duty-based response that does not alleviate suffering. The patients and the family members, they are very aware of this type of model of care, and they do not like it. They do not prefer it. It does not alleviate suffering for them. But what it does do is keep the healthcare practitioner or provider at a distance during the evaluation and treatment session. Empathetic care allows the healthcare practitioner or provider to be able to relate or empathize to the patient, but it does not alleviate suffering with any type of action, though it helps them empathize with the patients. The best model of care seen using this research information was compassionate care. And the reason why compassionate care was the best is because it had relational communication involved. The healthcare practitioners sought to understand their patients. And in doing so, they were attending to the needs of their patients by providing some type of action to alleviate the suffering of their patients and their families, even with a simple response of just being kind, a smile, or showing genuine interest in whatever their patients were sharing. The sympathetic model, the empathetic model, and the compassionate model here are all aligned for you on the screens. I want you to look closely at each sphere and note where the empathetic model transitions into the compassionate model, because with emotional resonance, effective understanding of a person's experience, person-centered response, and action to alleviate suffering, we can see that compassion is the best model of care. And keeping that in mind, here in our presentation, we have a few hands-on techniques for you. By taking 3 deep diaphragmatic breaths prior to entering a treatment room or beginning evaluation with your patients would be recommended. It helps you to just fully open up and clear the mind to prepare for treating your patients and families. Also, if you can, and between your shift work, if you can get a break and go out in nature and take in the sights and the sounds of nature, the green grass, the beautiful blue skies, if you can look at the beautiful blooms and flowers, just inhaling and exhaling the fresh air, sort of sets the pace and takes your mind away or puts it at ease during a shift. And then you can enter back into the setting and provide quality care. Also, there's aromatherapy. There's different types of portable, small eucalyptus, lavender, and all types of small aromatherapy bottles that one can carry just to get an olfactory, sensory whiff or sniff of those smells will alert the senses. Lavender calms, whereas peppermint may awaken the senses. Also, in nature existing, there is things like rosemary that may be planted around your hospital setting. That's also wonderful for waking up the senses during a shift. Also, if you want to put on a pair of earbuds and listen to your favorite song during your shift, just to sort of transport your mind and settle you, that's another great tool. These tools can be used during your shift work as a practitioner so that when you are ready to provide compassionate care to your patients, you'll be set for that. Also, make certain that you take time to do some extra things for yourself, such as self-care, so that when you provide compassionate care, you are in the best form, such as get enough sleep at night, exercise daily, eat nutritiously, and definitely ask for help when you need it, whether it's mentally, physically, or emotionally. Also, take time to relax and rejuvenate oneself by a walk on the beach or reading a book. Self care is one of the best things one can do to help deliver compassionate care for others. Now, I want you to think of some of these practices and put them in place today to increase your compassion when you are delivering health care to patients and families. We thank you all so much for listening to this presentation, and we thank the Schwartz Center, Compassion in Action, for hosting this wonderful conference. Have a lovely day.